G'day guys, Luke here. Welcome back to another video. In today's video guys, we're looking at part 4 of common illnesses in reptiles. Today's video we're looking at prolapse, egg-bound, soft shell, as well as fungus on shells. Of course, we are going to start with prolapse, and the symptoms is pretty obvious, especially having the inside organs on the outside where they should not belong. So what causes a reptile to prolapse? Depending on sex really. So with males it can happen when they get very excited with mating, and do so much of it, basically their junk is stuck out where they can't put it back in. Females is usually when they are laying eggs, when they're providing or laying lots of eggs. Sometimes they just prolapse, or there's a very big egg. Sometimes when they're strained too hard, the organs will just pop out. As well, having a very big poo can set it off. So if your snake or lizard is kind of badly constipated and it's straining quite hard, sometimes if it's pushed so hard it'll just pop it out. It's not a pretty sight. So how do you prevent an animal prolapsing? There's no real way to prevent it. It just happens, unfortunately. So it's kind of unlucky there on how to prevent it. The best way to at least trying to help the animal trying to get its internal organs back in on its own is obviously keeping the organ moist by a bit of paper towel, and as well apparently adding some sugar sometimes helps with the swelling. So when the swelling is reduced, hopefully the animal is able to absorb its internal organs back in, especially if it's just the cloaca just inside out or the male's hemipenis stuck out. But if it's much more than that, you have to go and see a veterinarian who can at least put the animal back together as quickly as possible and as safely as possible. Try not to put the organs back in yourself, because if they're put back incorrectly, you can actually run the risk of damaging your animal further. So what are the symptoms of a reptile being egg-bound? So when your girl is egg-bound, the symptoms I look for is them being lethargic. They'll be off food completely. Yes, as they develop the eggs, they'll eat a fair bit to at least sustain nutrition to the eggs. But once it gets to a certain point, they kind of stop eating altogether. But if they lost complete interest in food, that's probably a sign of egg-bound. Restlessness, abnormal swelling, and the inability to pass the eggs despite attempts are usually the symptoms I'll look out for. What causes a reptile to be egg-bound? Sometimes if the eggs have developed too much or too large inside the animal, she's unable to pass them through because they're just too large to pass through. Not the right temperature or humidity levels for her to nest, or if there's no nesting sites for her, she'll just hold onto the eggs until she finds somewhere suitable. Sometimes it can be too late and she will get egg-bound. To prevent an animal from being egg-bound, make sure you have the appropriate nest site for your animal to lay their eggs. If it's a dragon, somewhere to dig, like a nice deep container with some damp sand. A snake, a nice dark box with some sphagnum moss to go and lay the eggs, and whatever the case may be with other reptiles as well. Making sure you got correct heating and humidity levels as well is also great. That way she can at least pass the eggs safely and knows that this is a good environment to lay the eggs. The only source I know how to treat a reptile that is egg-bound is by seeing a veterinarian. Now there's two methods I usually do to provide some medication where I'll kind of either relax the animal to the point where it'll pass the egg safely, or give them that, I guess, adrenaline to push it through, or if it's too big of a need to pass through, they just open them up and take them out and then sew everything back up. For all our turtle keepers out there, there's two main things I look for in turtles. Even though I don't keep turtles, I do work with them, so I have gained a bit of knowledge on a couple of things I do get. First of all, it's getting fungus. Now, the symptoms I look for is either yellow, white or green funguses growing on the shell. The scale on the shell is peeling, loss of appetite and being lethargic are the main symptoms I'll look out for when turtles have funguses. What exactly causes a turtle to get funguses in the first place? There's three main things. One being water quality, two, not enough UVB, and three, not enough heat as well. Preventing funguses is quite simple by doing simple water changes. Normally I do about 20% water change to make sure I've got good water going through. Having a good filtration system also aids in getting rid of your bad bacteria, and having good healthy bacteria living in your filtration is good to kill the bacteria. The appropriate lighting, so heat and UV, and water temperature. So most turtle species here in Australia, I keep probably 20 to 24 degrees Celsius water temperature. Just on the warmest side, or I should say cooler end of the spectrum, where it's comfortable for them, but they'll come out of the water and sit underneath the heat and UV, or if you keep them outside, get some natural sun. When you do have funguses on your turtles, now one thing I should also mention too is never clean out your filtration system unless you have a clog in your pipes, because the idea there is trying to keep all the good bacteria in your filtration to get rid of the bad ones. Because if you clean your filtration, you lose all your good bacteria, and your bad bacteria set in there, and unfortunately, it's going to happen. Some people provide using water ager as well as turtle medication in the water. Sometimes the turtle stuff doesn't work, because I think at work we do use a different solution to battle funguses in turtles. If I remember to take a photo of the product that we use, I'll throw it up on screen. I'm pretty sure they're using it in fish instead, but it works on turtles just as well. Our last illness we're covering off in this series before we get into injuries in the next video is soft shell on turtles. As the name suggests, when your turtle has soft shell, the shell itself will be soft and squishy, and it's not as firm and solid as it should be, like a rock. There are 3 main factors that will cause your turtle to get soft shell. It's spending too much time in the water, not getting enough UVB and calcium in its diet, as well as not getting enough vitamin D as well. To prevent your turtle getting soft shell, of course, making sure you have the correct water temperature, very much like your funguses, having around 20 to 24 degrees Celsius, depending on the species of your turtle. Having the appropriate UVB and as well heat. Sometimes going and get some natural sunlight is beneficial for your turtle to recover with soft shell, as well as giving the appropriate diet that has calcium and vitamin D in it. Of course, treatment is having the correct lighting and heating, as well as giving a very rich calcium and vitamin D foods to help it bounce back from having soft shell. So thank you guys all for watching for part 4. Stay tuned for part 5, that's where I'll see you next. So thank you guys for watching, and I'll see you all in the next video.